Dr. Bhupesh from Dr. BKM Institute. Please subscribe our channel if you have not. And again, when you study, the only thing that matters is your mind. Today, I'm teaching you in not in formals, but again, my mind, it's right there for OET. So it's all your mind that's going to decide your journey, that's going to decide how good you are, and nothing else matters. And your mobile phone matters a bit because it troubles you. So keep it away, keep it out of reach. Of course, you are taking a class from your mobile phone, so not right away, but please take care of it. The most important thing that I want to teach about the grammar and the writing is that when you take your exam in OET, so what you need to write in that particular thing is second form. You just write this thing before starting your writing in the final exam. Second form was plus third form. Then you write, I take more, I want some more space. Then you write has plus third form, and then you write has been third form. So for all of you guys who are attending this grammar class for the first time, and for all my YouTube followers, this is something that's gonna change your life and make writing 10 times easy. That's it. So whenever you start taking your exam of OET or in the final writing exam, and also on daily basis before starting your writing, I'm expecting that everybody would do it every day without any failure. So what you need to do, you need to make this chart, and then you write this, and then you write past, and over here you write today. So this is the only grammar that is used in OET, and that will give solution to all our problems. Now I will tell you how to utilize this chart and how to make it easy. See, when it comes to OET, most of the letters, like this time, referred back letter has come in the exam. So obviously we are expecting that 90% visit letter will come. It is obvious because it keep on referred back letter is something that is most repetitive. So I'm not saying that referred back letter cannot come or discharge back letter cannot come. Maybe this time it was referred back letter to GP, so next time can be a discharge back letter. But this grammar tip will cover every kind of letter in OET. So when there is a visit letter, please understand there are many visits like 12 September, 14, 15 October, then you say 19th November. So the patient has done multiple visits. Patient has come to you for multiple visits. So the last date is 20th December, suppose. So if the last date is to 20th December, so most of the time, 99%, this is your today. Because the last date is where you start writing the letter that today on 20th December, patient is having this problem. That is why he needs this thing. Means what happens in OET letters, that you refer the patient due to the problem which is being faced today. Today is the most important. Today is the most important day or date, because if today the patient is having extreme headache, if today the patient is having extreme chest pain, so you might be suspecting that he is having myocardial infarction. You might be suspecting that he is having migraine or something. So you need a specialist. It can be an epileptic fit. So due to all these things, today visit is the most important visit where you get to know what exactly is happening the patient. So to write the purpose of this visit, I will show you the first paragraph coming from here only. This is the tense I will use. So first paragraph is always about today. So today says has plus third form or has been third form. So this has been, so this is for active. Second form, this left margin, I should also write this thing. This is active. Active means something that is happening by itself. So most of the time, what is active? Symptoms are active. Patient suffered from fever. Patient is suffering from fever. Patient has suffered from fever. Patient has complained of pain. So symptoms are always active. Rest of the things is always passive. Passive means anything done by the hospital, like physiotherapy was given, or I will say migraine was suspected, myocardial infarction was diagnosed, anything done by the hospital. So the diagnosis always done by the hospital. Signs like elevated temperature done by the hospital. So basically symptoms are by the patient active. Signs are always passive. Diagnosis is always passive. Treatment is always passive. because treatment is done by us, diagnosis is done by us, and then the thing that I was talking about is signs are monitored by us. So now I will teach you all the basics. I hope you all understand until now. If you do not understand, pause the video, watch this recording again. But telling you in simplified words, there are only two major tenses which are used: past and today, active and passive. These are the passive ones and these are the active ones. Active will consist of majorly symptoms. Patient suffered from fever. Today the patient has suffered from fever. On 12th September, patient complained of pain. On 10th, on 15th October, patient underwent surgery. These are the things done by the patient by himself. Over here, passive voice, on examination, the patient was found with elevated temperature. Patient complained of fever or suffered from fever. When we did the examination, we came to know that he is having elevated temperature. So fever is a symptom. Elevated temperature is a sign. So patient was found with. Patient was third form. Find, found, found. So the patient was found with fever. When today the patient has suffered from fever and the patient has been found with elevated temperature. So sorry, over here as well. So the past visit consists of these things: second form or was plus third form, and present, that is today, consists of has third form and has been third form. It is very simple. Now I will tell you in the letter. So now I'm taking you the application. The first paragraph, when you do in the visit letter, the problem of today, this letter is being written regarding Mr. X, who has been suspected with myocardial infarction, as he is having severe chest pain. Therefore, he is being referred under your expertise on urgent basis. So you can well understand to whom I am writing this letter. Everybody will speak because everybody is on mute, but speak in your heart. So I'm writing this letter to cardiologist. You are absolutely right. So that is what is the point. So you can figure out from here that the case has been suspected with myocardial infarction, as he is having severe chest pain. So this is present, passive voice. Has been suspected means has been suspected by us, by the hospital. So that is the only thing you write in the first paragraph. What is the main thing? Why are you referring the patient? So in visit letter, this is the only reason. Why you are referring the patient? Because he is suspected with this. Has been plus third form. So that is where in the exam, again, before you start your exam, you will always write this thing. That's the first paragraph. Second paragraph. So we took 12th September. I will take it on from 12th September. Let's say it is a cardio patient. On 12th September, S capital. No doubt, S capital. Small things and comma, please. On 12th September, suppose it is 2010. Suppose it is 2010. Let me get other people in. Yeah. So on 12th September 2010, that means the patient presented with chest pain, which was, I don't know about much about, things how to write it, but patient was, or you can say patient complained of chest pain. You can also say patient complained of. So active thing you can use patient complained of, or you can say patient suffered from. Obviously myocardial infarction is something that's going to happen at that moment only. It can't be a consistent pain, but I'm just telling you the pattern. So I'm just telling you the pattern. Please do not take it that way, but learn the tenses. The patient presented, that means by himself, active. Or you can write patient complained of, or you can write suffered from. So this is active. Let me take you back. Patient, second form, active. Past dates, on patient suffered from. Then you will examine the patient, which was whatever radiating to this and this thing. So it can be a headache case. It can be, if I say suspected with migraine, if I change the topic, let's say migraine. So now I'm referring to a MD doctor who can actually treat the patient. So patient presented with or suffered from suffered from headache. So that is how data will change, but your grammar will not change. Please keep your grammar intact. Try to fit in your letter in these small things. So which was radiating to the occipital lobe or whatever is given, you write that thing which was radiating to. So means you can change your letter according to the demands, and it is not difficult at all. Then you will examine the patient. So after symptoms, yeah, after symptoms there is always examination. On examination, this is the pattern of visit letters, and this will teach you a lot. On examination, now passive voice, everything would be passive. Only the first sentence is active, in which you are talking about symptoms. On examination, he was found with, now whatever your signs are given, he was found with D, E and F, whatever signs are given. Second line done. So first paragraph done, second paragraph 2 lines done. Third line, symptoms done, signs done. So what will happen is diagnosis or investigation done. Then the patient was advised. Again, was plus third form. See, now everything is was advised by us. Was plus third form. So patient was advised to undergo few investigations. In which is a very good connector. That is why I'm saying watch my videos 2 times, 3 times to learn commas, to learn connectors. So patient was advised to undergo, was advised, passive voice, to undergo few investigations in which again passive voice, it was found by us. It was found that he was having this and this problem. Paracetamol was given and rest was advised. How simple, rest was advised. Full stop, paracetamol was given and rest was advised. Done. Second, now it would be copy paste thing. So I'm copy pasting. Now the date is 15th October. Now the grammar will remain the same. On 15th October, I will change the date. That is how simple it is. On 15th October, the patient visited again with worsened symptoms. So the symptoms were worse. So last time when the patient came, we gave him the paracetamol. We recommended few investigations in which something was found. So we said patient that you are fine, you take the paracetamol and rest, take rest. On 15th October, that means almost after a month, the patient visited again with worsened symptoms. Worsened symptoms. On examination, I will like to change this word. After assessment, just to change the word. Otherwise, I can write the same thing. It is just I want to change the word. After assessment, he was found with whatever the new signs are given. So again, if investigations are given or whatever is given, suppose if the diagnosis is given. So say signs, symptoms. After that, now on the basis of signs and symptoms, the patient was diagnosed with, suppose diagnosis was done in this visit, or maybe if it is given in the question mark, that means the patient was suspected with. This you will learn with later. I'm just telling you the grammar today. So if it is a question mark, that means he is a suspected case. So was plus third form, again passive voice. So only the symptoms would be in active, otherwise everything is in passive. He was found on the basis of signs and symptoms. The patient was suspected with this. Now a connector with this, for which whatever medication was given and rest was advised. So again, so the second visit would be only that patient would be having worsened symptoms So investigations would be done, suspicions would be made that patient was suspected with this and that thing. Now today, that is again, I'm teaching you about grammar. So see, the only grammar you're using has been in the today. Past, in the past, no matter how many visits are there. Second form for the symptoms, rest all was plus third form. So there is no grammar involved. It is the right connectors, like in which it was found, for which medication was given, for which and in which means that investigations were done, in which X-ray was done, in which fracture was found, CT scan was done, in which that was found, MRI was done, in which this was found. So again, grammar will remain the same. So that is the best thing about OET. You won't have to take any risk. So in the second visit, if it is a past visit, so when today visit will come, so we will say today the patient has presented. Now the grammar is changing and the active voice is going from second form to has third form. Everything is same. Today the patient has presented with severe headache, which is not controlled, which is not every data would be given. Don't worry about data, which is not controlled even by medication. So the earlier headache was controlled by medication, but now the patient is having headache, which is not even controlled by medications. On being examined, please learn the variations. So first time I said on examination, second time I used after assessment. Now I'm using on being examined. Now the grammar change. He was found. Na. He has been found. He has been found with today's science. Therefore, he has been suspected with. He has been suspected with. Again, the same top line, which is same. Now you will say, sir, it is exactly the same. Can't we change it? Yes, we can change it. Therefore, now I will make a better line. Provisional diagnosis of migraine has been made. So again, the grammar is same, has been plus third form. Now I have just changed the sentence so that it does not match with the first sentence. Has been suspected with migraine. So I said, therefore, provisional diagnosis of migraine has been made. For which he is being referred to you, for which your expertise is highly required. So that is where I end my letter. That's it. Visit letter is all done. That is how simple visit letters are. Now the word count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Almost 20, 40, 40 plus 60, 100 plus 60, 160 plus this, around 220 or 210. See, this is how small OET letters are. And this is the only grammar that you have to use. And again, referred back letter has come. So next time it would be either a discharge back letter or would be this simple visit letter. But again, lot of data would be given. So don't worry, just write important things and fit in this grammar. You will be able to manage. This is all about OET, and that is why I keep on saying that OET is the easiest exam of the world. So please try and learn and write this pattern 2-3 times. Learn the commas, learn the connectors so that you don't have to worry again and again. Because worry comes when we do not copy. Please copy the pattern. Then improvise. Improvise means then you can add your lines. You can disregard your lines, but at least learn the basic thing first, where the comma should be, how the connectors can be used, therefore can be used, Sometimes it is not important to write so even. So I have used everything in this letter. And again, always make a chart. Please do not miss out on this chart. Even in your exam, even when you are starting your writing any day, do not miss out on this simple thing. This is active passive. So right one is passive. The upper one is for the past, and this is for today. And when you write the discharge plan, the only thing you can add on to this is the only thing you can add on for the discharge letter, because discharge letter means after the discharge, patient should be given this, patient should be given that. So that becomes should be third form. So that is the passive voice we use in the discharge letters. Discharge letters last paragraph. So we say the patient should be given this thing. This is the only grammar of OET. So when people tell me, sir, I want to join OET classes, but I think I should take grammar classes first, then why I get so confused about this statement is this is the only grammar you need, and that takes only 20 minutes. And if you revise this thing 2 times, that takes only 60 minutes. So anybody who is making an excuse of 30 days of delaying OET coaching just because of grammar, I'm sorry, this video 3 times will make you an expert of grammar and will help you to pass OET just like that. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. I'm going to attach another letter in the end now. It will pop up on your screen as a thumbnail while the video is ending. So this letter will take you a proper example of visit letter as well with the question paper. So please watch that video, and thank you for watching this video as well.